The sacrum. The sacrum is enough to bring dread and fear into any osteopathic medical student's heart and soul. One, it's really complicated and it's taught like it's really complicated. I'm going to try to distill it out into the more simple, basic portions of it. The starting place with the diagnosis of the sacrum is the seated flexion test. Just like the standing flexion test, find the PSIS by finding the iliac crest and tracing it back till you find the little bumps of the PSIS. I loop my thumbs underneath and then have the patient slowly bend over towards their feet. Much more accurate if they have their feet on the ground. She's positive on the right. The next step is to diagnose the sacral base, which we all know, ironically, is at the top of the sacrum, and the ILAs, which are at the bottom. The sacral base is found by, again, finding the PSIS, and then coming medial and a little inferior to their location to palpate the base of the sacrum. And after that, diagnose the ILAs. I take the heel of my hand and trace down until I no longer feel the sacrum, and right there is where the ILAs will be found. There are two other tests that are utilized. They are seen on tests most frequently, and you can also utilize them. Personally, I use the spring test sometimes to confirm my diagnosis, and the spring test is just pushing pressure on the sacrum. Does the sacrum have a little bit of spring to it, or does it feel like you're trying to push against a rock-solid door? If it is rock solid, that is a positive spring test. There is no spring in a positive spring test. And likewise, there is also the sphinx test where you have them come up on their elbows into a cobra-like position and feel and see, is the sacrum softer or not in that position. Again, these are most commonly seen on tests. You can utilize them to confirm your diagnosis, but they don't really provide any of the essential materials to make a sacral diagnosis.